I'm Dr. Corey. How you doing, Katie? We've had a chance to study the MRI and your CT scan, and we've gotten a pretty detailed look at your blood work.
Doctor, what is your specialty? No offense.
I'm an oncologist.
Oh, no. It was me, wasn't it? I gave it to him. I did, Doctor. I gave our son cancer.
That is absolutely not true, Mrs. Harkins. The blood work indicates that you have Lee-Fraumeni syndrome. It's most often caused by inherited mutations in the gene for P53.
Which means what in English?
P53 is the gene that stops the growth of abnormal cells. You have that mutation. You didn't give your son cancer, ma'am. It's an inherited gene that you got from one of your ancestors. Sometimes it skips a generation, sometimes 2 or 3.
So this syndrome is what caused the seizure?
No. People with Lee-Fraumeni syndrome are susceptible to various forms of cancer, including brain tumors, which I'm afraid you have. It's called the glioblastoma multiforme. It's a stage 4 cancer.
Oh my God, oh my God. What are my chances? I have decisions to make. I've got to know.
Unfortunately, the prospects are not good. It's a very virulent tumor. It's quite advanced. The tumor itself is interwoven with normal brain cells to such an extent that I wouldn't recommend surgery. There is an experimental protocol that involves chemotherapy. But quite honestly, I don't believe we'd be talking about a cure. I believe we'd be talking about buying you extra time.
How much extra time?
Months, possibly a year.
How much time do I have?
Months. There is a milder form of chemo that we could do. I'm not sure what the benefit would be.
What about this experimental program? Somebody has to have survived this thing.
5%. Maybe less.
So my question is, how long do I have before I don't feel fine?
I wish I could give you exact numbers, Mrs. Harkins, but I just can't. We certainly have drugs that can keep you comfortable once the pain sets in, if that's what you're thinking about.